Most of us have heard of pink eye, but what is it exactly? In this episode of OCuTALK, Dr. Jennifer Chinn will be telling us all about pink eye, the symptoms to look out for, and the potential treatment options, and what happens if we do nothing. Dr. Chinn?
I want to talk to you.
Not now, later.
No, now.
Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. Hello everyone, and thank you for joining us for a brand new episode of OCuTALK. My name's Nick, and today we have a very special guest joining us from San Diego, California, Dr. Jennifer Chinn. Dr. Chinn, thank you so much for joining us today.
Hi, thank you so much for having me. I'm so excited to be here.
Well, we're excited to have you here, Dr. Chinn. Thank you so much for taking the time out of your day to visit with us. Dr. Chinn, before we get started today, I was hoping that maybe you could introduce yourself to our audience, let them know a little bit about your background and your specialty.
Yeah, so as you said before, I am from San Diego. I'm actually a second generation optometrist, and we provide a lot of primary eye care, and we do a lot of dry eye as well, but lots of primary eye care in our clinic.
Well, awesome. Thank you for that introduction, Dr. Chinn. And again, thank you for taking the time out of your day to visit with us. Dr. Chinn, for our discussion today, we were hoping that maybe you can discuss with us conjunctivitis, or better known as pink eye. What exactly is pink eye?
Yeah, that's a great question. Conjunctivitis, or AKA pink eye, is basically inflammation or infection of the transparent lining of the underside of the eyelid and the white of the eyeball. So usual symptoms include redness, grittiness, itching, discharge, tearing, and some irritation.
Well, perfect. Thank you for that, Dr. Chinn. And so what causes pink eye to happen?
So there can be a lot of different causes. Most commonly, they're probably going to be viruses, bacteria, maybe some allergens in the environment or other irritants. Sometimes even STDs can cause conjunctivitis.
Oh, wow. Well, again, thank you for that information, Dr. Chinn. And Dr. Chinn, what's the most common way people get pink eye?
Yeah, this sounds really simple, but the most common way is by touching something that hasn't been clean and then rubbing your eye. So that happens a lot. We touch our face a lot more than we think we do. And other common ways would be sharing makeup or using old makeup, things like that.
Oh, well, excellent. Thank you for letting us know the most common ways that people get pink eye. And Dr. Chinn, I know you talked about it a little bit before, but can you go into a little bit more about the signs or symptoms that we should be on the lookout for to maybe alert us that we do have pink eye?
Yeah, so the symptoms of pink eye definitely are going to be redness, irritation, itchiness, sometimes discharge or watering of your eyes, and then light sensitivity. And then because of all those other symptoms, sometimes you'll have blurry vision as well. And then for some patients, occasionally it can accelerate into something more serious, like swelling of the eyelids.
Well, excellent. Perfect. Thank you, Dr. Chinn. And I know that when you said those symptoms right there, I know that some of those symptoms are kind of like other symptoms, when you get other eye infections. What would help someone to know that, hey, I need to go see a medical professional for this and go see Dr. Chinn to see what's going on? Yeah,
definitely. If you start to have blurry vision that does not go away. So even if you blink, you try to kind of put artificial tears in or something like that, the vision is still staying persistently blurry and cloudy, definitely go see an eye care professional. Or if the eyelids start to get swollen, that is usually a sign that the infection or inflammation is spreading and it's getting worse.
Thank you for that, Dr. Chinn. And are there risk factors that we should know about? I know you talked a little bit about blurry vision and, if it continues, we need to go see somebody, but are there things that we can do to prevent this from developing?
Yeah, so some of the things that I talked about earlier, how is this caused or what are the common causes? So of course, eyelid and eyelash hygiene is a huge thing. So make sure you're cleaning off your makeup, not using old makeup or sharing makeup with other people. If you wear contact lenses, don't abuse them. So don't overwear them, don't sleep in the lenses or take good care of them. And then of course, wash your hands as much as you can and try not to touch your face.
Oh, definitely great advice. Definitely everyone wash your hands. That's a great advice there. Dr. Chinn, what about, are there other treatment options available for conjunctivitis?
Yeah, so again, the causes for conjunctivitis can be a wide array of things. So sometimes, if we determine that the cause is bacterial, we can prescribe some antibiotics to treat it. If unfortunately it's viral, there's nothing we can really treat for it. Most of the time it's kind of like a common cold. And sometimes that happens for patients too, is they might have a cold and then it kind of spreads into the eyes because your eyes, nose, and your mouth are all kind of connected. So very common for people with some sort of flu or cold-like symptoms to get conjunctivitis in conjunction with that. And like that, you just kind of have to let it heal on its own. It will take time, but during the resolution period, if you have any symptoms, using cool compresses can kind of help, and using, of course, artificial tears to kind of flush your eyes out, clean them out as much as possible is great as well. And then, of course, during these times when you have conjunctivitis, don't wear your contact lenses if you wear reusable ones, because you can be reinfecting yourself. But yeah, those are definitely the treatment options.
Well, excellent. Thank you for letting us know the treatment options, Dr. Chinn. And so how long does pink eye usually last? You said like it's kind of like sometimes like if it's viral, it's like a common cold. How long does it typically last for somebody?
Yeah, typically it'll last anywhere from 1 to 3 weeks, and it's kind of like a long time frame or range, but that's just because it depends on how well you kind of maintain and keep your eyes clean. So for some patients, if they're not doing a great job, it could spread to the other eye. So some of the tips that I tell people are, of course, all the things we already talked about, like contact lens use and not abusing them, keeping your eyelids and your eyelashes clean, but also other things to think about would be like washing your pillowcases, anything that comes in contact with your eyes, or face towels. So don't reuse them when you are sick, just like you don't want to reuse a tissue, right? So you want to clean everything that comes in contact with your eyes as well.
Well, excellent. Again, thank you for that information, Dr. Chinn. And you actually talked about it a little bit before about if it goes untreated, something could happen. But what happens if it does go untreated? If say like, I'm fine living with this blurriness in my eye, like it's no big deal. Like, are there long-term side effects that we should be on the lookout for?
Yeah, absolutely. So if you don't treat it, so it can definitely kind of spread over to the other eye, like we talked about. And then it can also, the infection in the first eye can get worse. So it can cause corneal issues, so cause like a really bad corneal infection, or it can kind of get stuck into your eyelids and your glands and your tear ducts and cause like worse things like styes, which take much longer to heal. Or if it gets even worse, like I was talking about the swelling of the eyelid and really like lots of pressure in the eyelid and redness, then it could be a more serious infection that could even spread to the back of the eye or even the brain, which is very, very serious that we have to send patients to the ER for.
Yeah, definitely. We definitely want to get everyone to go get checked for that. Again, thank you for that information, Dr. Chinn. Dr. Chinn, are there any new technologies or developments that are on the horizon right now that we should probably be on the lookout for?
Yeah, so I think that technology is always growing, and like the things that I'm really interested in are equipment and tools that we can utilize to help us image and do more research on some of the reasons why things happen. Like some new things about dry eye are coming out, and why dry eye happens and how your glands are affected and what's going on in that process. And technology is amazing for that because we can image it and actually show the patient. So I'm really excited for things that can help us better diagnose, treat, and manage our patients, and even better show them what's going on so that they can really understand what's going on behind the scenes and how they can kind of prevent things from getting worse.
Well, excellent. That does sound like exciting new technology that's on the horizon there. Again, thank you for that, Dr. Chinn. And before we leave today, was there anything that you would like to tell our audience about?
Definitely just clean your eyelashes and your eyelids. Make sure to use artificial tears, especially for people that are on computers and digital devices all day. But yeah.
Well, you heard it there from Dr. Chinn. Clean your eyelids. Dr. Chinn, thank you so much for joining us today, everyone. That was Dr. Jennifer Chinn from San Diego, California. Thank you again for joining us.
Thank you for having me.